कमेटी भी जल्दी इस पूरे मामले की जांच करेगी।
Ji Chetan, in fact, this action comes days after so many deaths of those children were reported from Madhya Pradesh, and we can see that some action is now being taken. We see that the doctor has in fact now been arrested by the Madhya Pradesh police. We see that an FIR has also been registered against the manufacturer of the Coldrif, which is the Sri Shan Pharmaceuticals, which is a Tamil Nadu based company. And we are also seeing that now so many states are also currently banning this cough syrup. Meanwhile, I am currently joined live on the broadcast by Dr. Ishwar Gilada. Doctor, thank you for giving us your time and joining us on the broadcast. Really tragic news that is coming in from Chhindwara. We are seeing the lives of so many innocent children being lost. Finally, some action is being taken. What more details could you share us? How there are states that are actually banning this, cough syrup in place. What precautions could people now start taking since states are also banning this cold, cough syrup?
See, basically, there are a lot of lapses, and now whatever they are doing is just a knee-jerk reaction and scapegoating. What is the fault of a doctor? If you are arresting a doctor, doctor doesn't know what is the impurity in the particular bottle. So it is a job of FDA, it is a job of the pharmaceutical company or the supplier. So if you go same thing and do again and again after 40 years also, 40 years before similar tragedy happened, and that was at JJ Hospital Mumbai where I was attached, and 14 people died because of impurities in glycerol. And glycerol was given to these patients who were admitted in eye department for increased pressure in eyes, which is called glaucoma. One patient came, failed, became coma, went to neurosurgery, then kidney failed, went to dialysis, died. One after another 14 patients died between January and February 1986. Justice Lentin Commission was formed, and 290 pages report of Justice Lentin Commission shows how there is a nexus between the government agencies, FDA, pharma companies, and suppliers. How the systemic failure was there. And most importantly, the glycerol which was supplied was called glycerol IP. And here IP should have been Indian Pharmacopoeia, which is a medicinal purity. But that was glycerol IP, means industrial pure. So it was outsourced or sourced from industrial glycerol that contained 90% impurity as diethylene glycol, and people died. Now similar instances are happening after 40 years. That means we have not learned any lesson from Justice Lentin Commission. So we need to look at, number one, why different states have to give different advisory. There should be one advisory from Government of India, CDSCO or Health Ministry, that this cup syrup is banned. So then nobody will use. It's a knee-jerking reaction that one state issues a statement, another issues statement, another issues statement. Secondly, there is a postmortem done. Whenever you want to establish any kind of culprit, whether medicine or person or anybody, then you need to have a number one emergency police register, EPR. So any such kind of instances coming, either seriously sick or dying, that is emergency police register. So police gets involved. Then person dying, to postmortem. In postmortem, you preserve viscera. Viscera means, suppose in this case kidney is involved. You can see that the kidney color changes with the diethylene glycol. So preserve viscera, send them for chemical analysis in forensic lab. Now here we hear two different stories from CDSCO says no impurity found 2 days before. Yesterday lab in Chennai says impurity found. So when there is a dichotomy or different opinions, then a same sample, because when you go to this particular batch size of batch number of cup syrup, you take 5-6 sample, send it to central lab, send it to state lab, send it to IP lab, which is called Indian Pharmacopoeia lab, very nice lab, and independent lab wherever it need to be paid. So when you get report, then you can compile and say. Don't be in hurry to give a report that no, nothing was found, because you have not properly analyzed. So in this situation, if postmortem is not done, you cannot establish what was real killer. Only based on 1 or 2 tests where some kidney functions were derailed, we cannot go. So I think there is a total systematic failure. And here, number one, there should be no politics. Number two, it should be medical, forensic, police, and CDSO investigation. So you involve the experts. What has been a lesson learned from that particular 290-page document? And Justice Lentin has very clearly said that there was politicking, there was corruption, there was a systemic failure. So if those things are there, then you make a SOP. This is not happening first time. This happened 2 years before in Gambia. This happened somewhere in other European and African country where supply was from India. So I think we need to be very particular. And lastly, such kind of things should not be over-the-counter sell. You go to any pharmacy shop, you can buy anything. You don't need a prescription. And one prescription expires, till the person is also expired, but the same prescription is going on. And anybody is writing any kind of prescriptions. So it can be homeopathic person, Ayurvedic person, Siddha, Unani, writing allopathy medicine. And lastly, all this chemist shop or anything, they are purely for business. There's no human angle. So we need to have due diligence. When you are dealing with human lives, whether it's a medical college, hospital, doctor, or chemist shop, there has to be due diligence. What is the background of the person? Whether there's an expert like a B.Pharm or D.Pharm owning the shop. You cannot have just a certificate from some B.Pharm, put in a shop, pay that person 5,000 rupees per month and run the shop. And then you are likely to make such kind of mistakes.
Absolutely, doctor. You are right in saying that SOPs have been ignored and innocent lives have been lost. However, we can see that the Central Drug Standard Control Organization will direct the Tamil Nadu FDA now to take strict action against the manufacturers. However, I want to come back to you as a doctor. We have many pediatricians who are saying that, children under the age of 5 should not be prescribed such cold and cough medicines. So how do you see that? What precautions should people take going forward and in such cases? Because currently we are seeing that around 1,400 kids samples have also been sent for testing. So there are more lives at stake here.
See, we are definitely dealing with human lives, and we should be very particular while prescribing, number one. Number two, no medicine should be sold without prescription. Number three, glycerol or glycerin is used as a viscosity agent for that particular cup syrup. So again, we need to go back. Can we provide cup syrup as a powder and then they can constitute at home and take it? Number five, whether it is really required. So if there are other options to be given, look at that. Whenever advisory comes, 2 days before there was advisory that children, this particular cup syrup should not be given to children below 2. Now you are saying 5. So we are not sure whether 2, 5. So I think at this stage, we should ask people to refrain from using any cup syrup. We are not sure whether ABC model or ABC kind of batch is pure or not. We found one culprit, but there may be many culprits. We found one culprit where the outsource of glycerol or glycerin or DEG was outsourced from some particular industry. But that industry may be supplying to tens of other pharma companies. So we need to look at every angle. Go to that industry. Who is the supplier? How many pharmaceutical companies he supplied? Go to those pharma companies. Do that backtracking. Till that time, no cup syrup should be used. So we need to give this kind of guidance. We cannot blame only one community, that doctor. We cannot blame one community as a supplier. But we need to look at that. And mostly all these deaths happen in government hospitals. In the government hospital, there's a system of buying from rate contract. Rate contract is they do not see the quality of product. They see the cost of the product. So it's called lowest cost product to be bought. So under this situation, all this kind of thing will happen. So we should not go below particular standard. And lastly, I would like to also state that every state has a food and drug administration. When you have a food and drug, that means the inspector's time is spent more on food than drug. Now during Diwali time, there will be a lot of adulteration in milk and different mithai and sweets. All these inspectors will be busy in those things, not in medical shops or medical pharmaceutical industry. So I think we need to categorically mention that what is drug administration. Separate it out. The drug and food, there is no combination anywhere in the world. So we should go by that. DCGI in India is the only drug administration. So likewise, in the state should be only drug administration. Why they should be food and drug? And then they don't come under health ministry. They come under another different ministry. So any kind of medical supply or raw material is under chemical and fertilizer ministry. It's not under health ministry. So I think we need to look at a lot of cohesiveness, whether it exists or not. What are the SOPs? How that can be changed with 1, 2, 3, 10 instances? Can we have a better system? I think we need to look at all that. So there's
Absolutely.
a short-term measure, mid-term measure, and long-term measure, and everything should be thrust out threadbare.
Absolutely. Thank you so much, Doctor, for joining us and providing us those valuable insights. We clearly need to